you are. So I'm excited to be here tonight. Who's excited to learn about stem cells? Awesome. All right, can everybody hear me okay? I don't have a mic, so I just have to talk loud. Most of my family and friends tell me that's not a problem. So, all right, a little bit about me. My name's Dr. Shannon Bone. I'm a practicing physician here in Jackson, Tennessee. Been here since year 2000, so I've been here, actually September will be 17 years. I'm originally from Dresden, Tennessee. How many of you know where that is? Yep, Class A state football champs. That's right. Plug from my alma mater. So, why are we here? Why are we here to learn about stem cells? Well, a little bit about our practice. We have 2 offices here in Jackson. They're actually in the same location, same building, 2 separate entrances, and they specialize in 2 different things. One is our urgent care. It's called 45 Urgent Care. We're out on the North 45 bypass, right next to LabCorp, across the street from Lifeline, across the bypass. It's a traditional walk-in clinic. We see everything from cuts, bruises, burns, bunny noses, you name it, we see it. If you're tired of waiting long waits in other offices, our wait time is 15 minutes or less typically. So if you don't like sitting in the doctor's office waiting a long time, our facility is for you. Our other practice is called Advanced Rehab and Medical. It's our physical medicine and rehabilitation clinic. So what we focus on there is helping people who have musculoskeletal pain. So we treat everything from sciatica, herniated bulging, degenerative disc, carpal tunnel, fibromyalgia, plantar fasciitis, temporomandibular joint problems, tennis elbow, rotator cuff issues, headaches, neck pain, back pain, any of those things, and peripheral neuropathy, osteoarthritis, knee pain, hip pain, anything in that realm is in our wheelhouse. And so we use a lot of different methodologies and treatment methodologies that are, some are mainstream, some are very outside the box. And so we're always looking at cutting edge, always looking at pushing the envelope on how do we improve patient care and provide results that no one else can. And that's kind of our objective, is we want to provide excellent health care to help people to regain their health, improve their function, improve their quality of life with innovative collaborative health care. That's our mission. And so we have a lot of resources to do that with. And in the 17 years I've been in practice, I've had an opportunity to travel most of the United States helping other clinics as a consultant. I practiced for about 12 years, and then, have you ever had a job where you kind of got burnt out on? Okay, I did. So I got to a point where I was a little bit tired of seeing patients every day, and we've been quite successful at helping patients, and we had a lot of people that wanted our help to help us teach them how to do what we were doing. So traveled the country for about 3 years helping other clinics as a consultant, and got to see a lot of things, meet a lot of people. And I've never been more excited in all my years in healthcare than I am right now about stem cell regenerative medicine, because I've actually never seen anything work as well as this works. Okay? So, after I started learning about stem cell and regenerative medicine, I knew that it was out there, but I really started doing a lot of research about 18 months ago, and dove in to learn everything that there is to know. And so I hope by the end of the night that, I feel like that you will, you're going to know about 90% more than everybody else on the planet about stem cell and regenerative medicine, probably including your own doctor. There's less than 1,000 clinics in the United States that are providing stem cell treatment. Actually, I think that number is about 880. And so we're one of those. We're an early adopter, and we're excited to be able to provide stem cell treatment to West Tennesseans, and actually we have people coming from other states all over to come see us. And the results that we're getting are nothing short of miraculous, but it's not the stem cells that are miraculous, it's you that are miraculous. And I'll explain how the stem cell therapy works and how your body uses those to heal itself. So, that being said, let's get started. So how many of you, obviously you've heard of stem cells or you wouldn't be here, how many of you, is there anybody that's had stem cell therapy? Anybody here had stem cell treatment? Okay. Stem cell treatment in the United States has been around since about 2005 for orthopedics, for physical medicine and musculoskeletal conditions. But up until recently, that had all been done with adult stem cells. And I'll explain the difference a little bit later on and the different types of stem cells that are available to us. So most of the time, if a person has had stem cell treatment, depending on what it was for, most of the time I find that they went out of the country to do that. And there's certain reasons why, and I'll explain that as well as the different regulations that we have to adhere to here in the United States. Okay? So if you're here, I found that you're here for one of two reasons. Either you just wanted to show up and hear about stem cells and get a free meal, and God bless you if you're here to do that, no problem. Learn all that you need to learn, enjoy your meal, and we're glad you're here. The other reason is that you are here or for yourself or for a family member that you're hoping that I teach you something tonight, that there's hope for a condition that you have or a family member has that this can help you. Okay? How many of you are in that position? Actually, most of the room. Okay, great. So I'm hoping to be able to provide those answers for you. I will ask that if you have questions as we go through, because of the number of people in the room, let's try to hold those to the end. And I'll stick around for as long as you guys want to try to answer questions if I don't answer them during our presentation. All right. So our clinic is actually an affiliate clinic of what's called the Stem Cell Institute of America. And our purpose, as I mentioned, is to help people get out of pain, regain their health, and maximize their health for the rest of their life. Which up until recently with stem cells, that wasn't always possible to help somebody have a permanent result. Most of our treatments in orthopedics and physical medicine are somewhat temporary at best, depending on the amount of degenerative change that's happened along the way. So once our body starts to degenerate, you understand that process is not going to stop. Okay, we're all going to die, and we're all going to get older. All right. The question is that at what point are we going to die, and then while we're here, what kind of quality of life are we going to have? Okay, so that's the big thing. Is that I see people. I have relatives that have lived to be over 100, but the last 15 years of their life, all they did was lay in a bed. Well, that's no way to have life. To me, that's not life. Life is living, and it's meant to be lived. I hope you all would agree. Yes? Most of the patients that come in that choose to have this therapy or other therapies that we offer in our office, what I find with consulting with patients, it's not necessarily the pain that they can't deal with, although pain stinks, nobody wants it, right? It's not the level of pain, it's the limitations in function. Meaning, I can't go to the grocery store and shop because I can't stand long enough, or I can't walk long enough. I can't go on trips with my grandkids because, I'm in too much pain to be able to walk or do what they're doing. I can't go fishing. I can't ride my Harley. These are the things that people's goals and motivation are. And so it's not just about taking your pain level on on a visual analog scale from a 10 to a 2 or a 10 to a 0. It's helping you to reach your goals that you want to reach. And there's nothing that we've done in the 17 years I've been in practice that works better than this to do that. Okay? So, body won't stop degenerating unless we regenerate. And that's one of the things that you have to think about regenerative medicine and stem cell therapy that's so different from everything else that we have to offer. Because for the first time in our lives, we have an opportunity to take something that's damaged, that your body couldn't heal, that's been that way for a long period of time, and then your body actually regenerate new living tissue and heal that area back to an earlier state in your life. That's truly anti-aging, and I actually can show you diagnostic x-rays before and after before we leave today, and you'll see what I'm talking about. It's quite amazing. Okay, so let's talk about most of the presentation that I'm going to go over tonight and the application of regenerative medicine and stem cells has to do with orthopedics. A lot of the presentation has to do with knees. Why is that? Well, we find that about 7 out of 10 of our patients that come in for stem cell treatment come in because of osteoarthritis of their knees. Certainly that's not the only thing that's applicable, but since that's the focus of what you guys want from me, that's what I'm getting. All right? Understand that stem cell treatment can actually be applied across a large number of dynamics, not just orthopedics. It can be and is being applied to certain chronic conditions like COPD, MS, Parkinson's, rheumatoid arthritis, cancer. So chronic conditions that haven't responded to traditional medical treatment or haven't responded in a way that has been beneficial, or the patient is at a place where they're in a good state, these things can be applied, and they're being applied with phenomenal success. So I want you to understand that almost any problem can potentially be treated with stem cell therapy. That doesn't mean everybody's a good candidate, but understand that every problem potentially can be treated with stem cell treatment. So for our purposes today, and I'll answer other questions later if you have questions about some of those more chronic conditions, our purposes today, we're going to talk about arthritis and joint arthritis. So does anybody want to volunteer and tell me what arthritis means? Crickets. Yeah, it's exactly right. Inflammation of the joint. Itis means inflammation. Arthra means joint. Inflammation of the joint. So why do you get inflammation in a joint? What is inflammation? Okay, so inflammation, anybody ever sprained an ankle? Okay. Doesn't feel good, does it? It'll swell. So that's inflammation. Why does your body cause the swelling? Well, that's actually a chemical process that happens that begins remodel and repair. Your body trying to heal whatever tissue is damaged. Okay? So when you get inflammation in a joint, that's actually your body trying to repair damage that is occurring. What happens over time is that because it can't repair it and it can't fix it, it stops trying to do that. Okay? And it'll actually, as we show these progressions, it'll try to start fusing the air to protect it. So this is a picture of a knee. This is the inside of the knee. This is the outside of the knee. You might not be able to see it. Hey, Christy, will you close those blinds for me so we don't have such a glare? So the outside of the knee, you can see the little bone called the fibula. That's on the outside of your leg. That's actually represented here. This is the medial side of the knee. This is the femur. This is the tibia, so big bone up top, little bone up below. This is the inside of the knee, or the medial side. This is the outside. So the space or the dark area that you're looking at there is actually cartilage. Okay? Can you tell the difference between the outside and the inside? Okay, so about 7 out of 10 osteoarthritic knee patients have more degenerative changes on the inside of the knee than the outside of the knee, and that's simply because of the biomechanics in our gait and how we walk. Okay, so the people that have more on the outside, ever seen anybody bow-legged? Okay, well that's why. You ever seen anybody that are more like this? Okay, that's where you're going to have more arthritis on the inside. Okay, so what happens in phase 1 osteoarthritis is the cartilage begins to deteriorate. You got inflammation there, it's trying to heal it. The cartilage begins to deteriorate because of wear and tear. Okay? Most of us probably have some form of degenerative arthritis in our knees if we're old enough. And as it gets worse over these progression, you start to have symptoms that make you want to go have it evaluated and do something. So this is phase 1 osteoarthritis is a point where you're starting to notice that you have knee pain and it's there on a more regular basis. It's probably not too severe, probably not really limiting at this point, but it's nagging and it's uncomfortable and it's kind of aggravating. Okay? You go to your doctor, and typically at that point you're going to go through a scenario of being prescribed like a anti-inflammatory, possibly physical therapy. Those are the typical pharmacological or medical treatments in phase 1 osteoarthritis. May even tell you to take something over the counter like ibuprofen or an Aleve that's an NSAID, so it's a non-steroidal anti-inflammatory, to limit the inflammation, help with the symptoms. Is that doing anything to fix the problem? No, you still have the wear and tear, you're just treating the symptoms. Okay? So as that progresses over time, the degeneration, because we didn't do anything to fix the degeneration, we were just treating the symptoms. over time you start to get more wear and tear, and you can see in this particular x-ray that you have less space on both sides. So this would be phase 2 osteoarthritis. This is about the point where you start really having some trouble, and you're probably getting a cortisone injection. How many of you have had a cortisone injection? Okay, you're going to understand in a few minutes why that's not a good idea anymore. And then possibly you've tried like viscosupplementation or the Rooster shot for treatment as well. Now, these are all things that we offer and we do in our office, but I'm going to explain to you why this is regenerative medicine is such a better option for you. Okay, phase 3. This is when you go, and by this time your primary care has probably referred you to an orthopedist, and they evaluate you and they say, well, you're bone on bone, and you need a knee replacement, or you need a hip replacement, if you're talking about a hip. Okay? Anybody been there? Okay. All right. So, this is at a point where it's really starting to affect your life, and, you know, you want to do something, but you're not quite sure you want to have a total knee replacement or something that invasive quite yet. Some of you aren't to the age to have it because you know if you have it now, you're going to have it again. Am I hitting home with anybody? Not here. I've done this a few times. Okay? Treated lots and lots of patients with these conditions, so I kind of know the scenarios. Okay. So in this particular situation, in phase 3, you can see the whitening here. This is what we call sclerosis. So your body's actually starting to lay down calcium deposits. It's actually starting to try to fuse this area so that no more damage occurs. Because if more damage occurs, you start getting cysts in the bone, you can get infection in the bone. There's a lot of things that can happen because you no longer have padding between the bone and you're rubbing bone on bone. So when you get to this state, you also start to lose a lot of mobility. You don't have good flexibility. Not only does it hurt, but it's very stiff, hard to go up and down steps because you can't bend your knee correctly anymore. Okay? Not good stuff. All right. So, at this point, if you haven't already, you have, if you don't mind me borrowing yours, you have a little survey here that we would like you to fill out. If you are here and you have a condition that you would like for us to consider to see if you're a candidate for stem cell treatment, please fill that out. Be thorough. Most people that come have at least one problem that they really are focused in on, but some have multiple problems. I've had patients that come in and said, well, I've got a bad left knee, I got a bad right hip, and I got a bad left shoulder. Okay? So can you treat all those things with stem cells? Well, the answer to that is yes. Potentially we can treat all of those things. All right? So let us know what all is going on with you. All right, so I want you to think about something for just a second. Because most people, it's hard to get the grasp on this, and it is, and at least it was, for us too, is that understanding, like, if you, whatever problem you're suffering with, and whatever limitations that it is giving you in life, okay, what if that wasn't there anymore? Like, have you ever just sit and close your eyes and said, what if my back didn't hurt anymore? What if my shoulder didn't hurt anymore? What if I didn't get headaches? What if I didn't, whatever it is? What if that wasn't there anymore? Can you go back and remember an earlier time in your life when that wasn't there? And what life was like? Yeah. Oh, I'm not immune. I had a torn ACL that I did stem cell treatment on. I'm in the same boat you guys. Okay, so I understand. So it's really fascinating, and it's really cool to think that there is a treatment methodology now that is available to help you to regain your health without having to have invasive surgery, without having to be off work for 6 months or go through rehab and actually get back to an earlier state of health. That's what's amazing about it. Okay, so I would think that that's kind of a dumb question. If you could get rid of it, you would, right? That's why most of you are here. Okay, so most of our treatments in traditional medical approaches for musculoskeletal care is not regenerative in nature. Now, we've had lots of patients. We've treated somewhere above 20,000 patients at our clinic in the West Tennessee area over the last 17 years. And a lot of those patients have responded extremely well. There's been some that have not responded well. But none of those patients, when we had osteoarthritis to a severe degree, have we actually been able to reverse the condition. We might get rid of their symptom, we might improve their quality of life, but the reality is if they're 50, at some point later down the road, that problem's going to return, right? Because we didn't do anything to actually stop the degeneration. Okay? So understand that from the time that you're born up until about age 23, you're growing, your cells are multiplying, you're developing, you're maturing, and guess what happens at age 23? You start dying. No other way to say it. So we start degenerating. We start degenerating. Okay, so this is the first thing that we've had in medical treatment that actually can stop that or reverse it. All right. So you got to think, regenerate. Because a lot of times I'll have patients come in, even after going through this lecture, and they'll say, Dr. Bone, my case is so severe. Is this really going to help? Well, you got to, and then how long will it last? That's usually the question. How long will it last? Well, if you regenerate something and you actually take something that wasn't there and you replace it with new and living tissue, then it's not a temporary treatment. It's actually regenerating. So if your age is, if you're 60 and it took you 60 years to lose all of the cartilage in your knee, and then we are able to do stem cell treatment and get the cartilage back, then my answer to you is, I guess it'll take 60 years, because that's how long it took you to wear it out the first time, right? So that's the difference in it. The treatment is not temporary in nature because you're actually getting new living tissue, and I'll show you that here in just a few minutes. Remember earlier when I said about if you're getting cortisone injections, you're going to want to understand, stop doing that? I want to give you an analogy. Okay, so I'm a kind of a car guy. I like cars. I worked on cars growing up. My father had a little service station there in Dresden. He had me start working out when I was about age 3. No, I was about 10, really. There were no labor laws. You know, when you work for family, I made about $1.50 an hour. Work all week, and I might have gotten home with $150 if I was lucky. And then if the drawer was short, then I'd just give him my checks. Anyway. Taught me a lot of things, like I don't want to work in this service station in 130-degree heat the rest of my life. I'm going to do something different. But I learned a lot about taking care of cars, and so I'm going to use a car analogy for a second. Any guys in here car guys? Car and truck? No? Okay. Wrong crowd. I need another analogy. All right. So anyway, if you took your car, like George is a pretty good mechanic. Pretty good mechanic, aren't you, George? Yeah. Did you fix Christy's car, by the way?
Not yet.
Not yet? Okay. I'll take that, I recant. But no, George is a pretty good mechanic. So if you brought your car into me and the check engine light, service engine light was on, and I said, well, you know, I see the check engine light's on, I'm sure there's something wrong with it, but you know, if I just reach under here and pull the fuse out and it goes to that light and the light's not on anymore, yeah, we won't see the light, there ain't nothing wrong, right? No, something's bad going to happen to that vehicle, right? I'm not going to be a good mechanic if I do it that way. So what do you think's happening when you have symptoms, your warning sign? Symptoms are a warning sign. What do you think when you have symptoms, your warning sign's on, and then we take something to artificially cover that up because it covers up the pain sensation actually that happens in our head? Or we take an anti-inflammatory so we don't have the inflammation, so we don't have pain anymore. Isn't that the same concept as pulling the fuse? So what happens over time? The problem gets worse, right? The problem gets worse over time, not better over time. Now, we might have managed the symptoms for the short term, but over the long term, we're still getting worse over time. Hence why we looked at those progressions in osteoarthritis, because nothing was done to intervene. Now, get me, I understand you're in a great deal of pain, you're just looking for a solution. And if there wasn't a good solution, you know, you're not just going to walk around in pain all the time. I understand that, but understand the thought process is, I had a lady come in, and where I'm going with this is, I had a lady come in, and to be evaluated for stem cell treatment for her knee, and she had had 42 cortisone injections in her knee and had had 3 surgeries. Okay, not replacement, but 3 surgeries. Meniscus tear, ACL tear, those types. 3 surgeries, 42 cortisone injections. Now understand that stem cell treatment, as miraculous as it is, 42 injections in one joint. Did you know that you lose 8% of the bone mass in a joint every cortisone injection that you get? That's why we limit how many you can get. Okay, so you think about, say you've had 3. Well, 24% bone loss you are experiencing in the integrity of the bone and joint. So when she told me she had 42, I was like, I'm anxious to see an x-ray because I don't know what's going to be there, if there's anything there to work with. Believe it or not, we've seen stem cell treatment even work for avascular necrosis, which is a condition where you lose blood supply to an area. It often happens in the hip, and then the hip will actually start to die because it doesn't have good blood supply. So we've actually seen stem cell treatment and done vascular studies to determine whether we created new vascular supply to the hip, and we did, and then the actually hip started to come back to life. So, even so, we evaluated her and we treated her, and she's doing quite well. But understand, and by the way, her goals, when I was talking about goals, was she said, Dr. Bone, I want to be able to dance, I want to be able to fish, and I want to be able to ride my Harley. So she's doing 2 of those 3. We got to get her on the Harley, but she's got another knee that we got to handle first. But she's doing great. But I was quite surprised that she did great because of the amount of treatment that she had had with the corticosteroid. You basically destroyed the integrity of the knee. We were able to get it back with stem cell treatment. Okay? So that's my warning to you. The other thing is, if you're taking medication, I have people come in all the time and tell me they're taking this or they're taking that. You know, how do you manage your pain? I'm taking ibuprofen. Well, how long have you been doing that? 5 years. How many ibuprofen do you take a day? Well, it varies, sometimes 2, 3, 4, 5. You've been doing that for 5 years. So think about that for a second. There's 365 days in a year. If you took 1 a day, you've got 365. If you took 2, you're at what, 7, what is that? So 730. You know, and if you've done that for 5 years, now you've taken 35 ibuprofen or Aleve over the last 5 years, 3,500, 3,500. Do you understand how you could have some kidney issues, some stomach issues, those types of things? The FDA says that anywhere between 10 to 20,000 deaths per year happen because of over-the-counter NSAIDs. Okay? So people think because you don't have a prescription for something that it's safe. That's not the case. Now, I'm not saying taking an occasional ibuprofen